The next time you brush your teeth and see a little bit of pink in the sink, do not tell yourself that's normal, because that is the single most misunderstood warning sign in your entire mouth. Quick question. When you brush or floss, do your gums ever bleed a little? If you just thought, yeah, but that's normal, I need you to stop, because that is the single most misunderstood warning sign in your entire mouth. Healthy gums do not bleed. That little bit of pink in the sink is your body waving a red flag, and ignoring it is exactly how people end up losing teeth they could have saved. Today, we're breaking down gum disease, the slow, silent, sneaky reason adults lose more teeth than anything else, and the difference between the stage you can reverse and the stage you can't. Let's get into it. Gum disease is wildly common. Nearly half of adults over 30 have some form of it, and most of them have no idea. It earned the nickname the silent disease, because for a long time, it doesn't hurt at all. By the time it hurts, it's usually advanced. There are two main stages here, and the names sound scary: gingivitis and periodontitis. But the difference between them is genuinely the most important thing in this video, because one is completely reversible and the other is permanent. Stick around, because I'll show you exactly where that line is and how to know which side you're on. First, the cause, because it's not complicated. It all comes back to plaque, that sticky bacterial film. When plaque builds up along your gum line and you don't clean it off, two things happen. 1, the bacteria irritate and inflame your gums. 2, if it sits there long enough, plaque hardens into tartar, also called calculus, a rough, cement-like deposit that you cannot remove by brushing. Only a dental cleaning can scrape it off. And tartar is the worst, because its rough surface gives even more bacteria a place to cling and dig deeper. So gum disease is basically what happens when plaque is allowed to camp out at the gum line undisturbed. Stage 1 is gingivitis. The word literally means inflammation of the gums. This is your gums reacting to that plaque buildup, and the signs are red or puffy gums instead of healthy pink, gums that bleed when you brush or floss, and maybe some persistent bad breath. Notice what's missing: pain. Gingivitis usually doesn't hurt, which is exactly why people ignore it. Here's the crucial part and the good news. At the gingivitis stage, there is no permanent damage yet. The bone and fibers holding your teeth in are still completely intact, which means gingivitis is 100% reversible. Clean off the plaque consistently, brushing, flossing, a professional cleaning, and your gums can heal completely and go right back to healthy. This is the window. So how does it cross the line into something permanent? If gingivitis is left untreated, the constant inflammation starts to do real structural harm. The gums begin to pull away from the teeth, forming little pockets. Plaque and bacteria slip down into those pockets below the gum line, where your toothbrush absolutely cannot reach, and they keep multiplying in the dark. The infection deepens, and now the body's own inflammatory response starts breaking down the bone and connective tissue that anchor your teeth. The moment that bone and those fibers start being destroyed, you've crossed from gingivitis into periodontitis. And that you cannot get back. Stage 2, periodontitis, is the serious one. Now we're past inflamed gums into actual destruction of the support structure, the bone and ligaments holding your teeth in your sockets. The pockets get deeper, more bacteria, more bone loss, a vicious cycle. Signs you've hit this stage: gums that are receding so your teeth look longer, persistent bad breath and bad taste, gums that feel tender or look like they're pulling away, and eventually the big one, teeth that feel loose or actually shift position. Here's the hard truth. The bone that's already been lost does not grow back on its own. The goal of treatment now isn't to reverse it, it's to stop it from getting worse and save the teeth you've still got. Untreated, periodontitis is the leading cause of tooth loss in adults. Full stop. And here's something a lot of people don't realize. This isn't just about your mouth. Gum disease is a chronic bacterial infection with constant inflammation, and that doesn't stay politely contained in your gums. Research has linked serious gum disease to a higher risk of heart disease, complications with diabetes, and other systemic issues. The mouth is a doorway to the rest of the body, and an infected, inflamed mouth is a problem the rest of you ends up paying for. So treating your gums seriously is part of treating your whole body health, not just your smile. So what's the treatment? For gingivitis, it's beautifully simple. A professional cleaning to remove the tartar, then solid daily brushing and flossing to keep plaque from rebuilding. Done. Reversed. For periodontitis, it's more involved. The main treatment is a deep cleaning called scaling and root planing, where the hygienist cleans the bacteria and tartar out from below the gum line and smooths the root surfaces so the gums can reattach. In advanced cases, there can be antibiotics or even gum surgery. The key theme: the earlier you catch it, the simpler and cheaper to fix, and the more of your natural smile you keep. It's that simple. Prevention is genuinely easy. which is the frustrating part about how common this is. Brush twice a day, focusing gently at the gum line, where it all starts. Floss daily, because that's the only thing that cleans between teeth and just under the gum edge where plaque hides. And get a professional cleaning every 6 months to scrape off any tartar before it can do damage. That's it. That routine stops gum disease before it ever begins. And if your gums are already bleeding, don't brush less, that's backwards. Gently brush and floss more consistently, and it'll often calm down within a week or two. Gum disease isn't purely about how well you brush, and it's worth knowing what tips the odds, because some people progress faster than others. The single biggest controllable risk factor is smoking and vaping. They choke off blood flow to the gums, mask the bleeding that would normally warn you, and dramatically accelerate the bone loss. So smokers get more severe gum disease, and it's harder to treat. Poorly managed diabetes is another big one. It works in both directions. High blood sugar feeds gum infection, and gum infection makes blood sugar harder to control. Hormonal changes, during pregnancy for example, can make gums more reactive and prone to inflammation, which is why dental care matters during pregnancy. Stress, certain medications that cause dry mouth, crowded teeth that are hard to clean, and simple genetics, they all play a part too. None of this means you're doomed if a few apply to you. It means you may need to be more proactive, tighter daily cleaning, more frequent professional cleanings, and not brushing off early signs. Knowing your risk factors lets you compensate for them, instead of getting blindsided. If a dentist says you need a deep cleaning, the official name is scaling and root planing. Here's what that actually involves, so it's not scary. A normal cleaning polishes the parts of your teeth above the gum line, but a deep cleaning goes below the gum line, right into those pockets that have formed to remove the hardened tartar and bacteria that are driving the bone loss. And then, it smooths the root surfaces so the gum can reattach more cleanly. Because it works below the gums, the area is usually numbed so you're totally comfortable, and it's often done one section of the mouth at a time across a couple of visits rather than all at once. Afterward, it's normal for the teeth to feel a bit sensitive and the gums to be tender for a few days. Your dentist may suggest a specific rinse or extra gentle care while things heal. The goal is to halt the disease and give your gums a chance to firm back up and reattach. Then it's on you to keep the pockets clean with daily flossing and good brushing so it doesn't rebuild. Ha! People often dread it and then report it was far less bad than they imagined. Whatever your specific gums needs is a conversation for your dentist, but the takeaway is this is a routine, well-established treatment, not something to avoid out of fear, because avoiding it just lets the bone loss continue. You've got this. Let me give you the exact daily routine to reverse gingivitis while you're still in that fixable window, because this genuinely works. Brush twice a day with a soft brush, angled at 45 degrees right at the gum line, gently, since that crevice where tooth meets gum is where the trouble starts. Floss once a day, ideally at night, to clean the spots between teeth and just under the gum edge that the brush can't reach. This is the step that targets exactly where gum inflammation begins. And get the professional cleaning to remove any tartar that's already hardened on, because once plaque turns to tartar, you cannot brush it off. Only a hygienist's tools remove it. Here's the encouraging part. When you start doing this consistently on inflamed gums, they may bleed a bit at first. That's the existing inflammation, not new damage. And within 1 to 2 weeks, the bleeding usually fades, the puffiness goes down, and the color shifts back toward healthy pink. That improvement is the visible proof your gums are healing. The key word the whole way through is consistent. Sporadic flossing won't reverse it, but 2 weeks of steady daily care often will, as long as you're still on the gingivitis side of the line. Lock in the single most important takeaway from all of this, because it's the one that saves teeth. Bleeding gums are not normal. They are early gum disease caulking, and at the gingivitis stage, you can completely reverse it with consistent brushing at the gum line, daily flossing, and a professional cleaning. Cross the line into periodontitis and you're into permanent bone loss and the genuine risk of losing teeth, the leading cause of tooth loss in adults. The entire game is staying on the reversible side of that line, and the warning bell is right there in your sink every morning, if you're paying attention. Don't brush less when your gums bleed, that's backwards. Gently and consistently clean more, and watch them heal. So let's lock in the one thing that matters most. Bleeding gums are not normal. They're early gum disease, and at the gingivitis stage, you can completely reverse it. Cross into periodontitis and you're into permanent bone loss and the real risk of losing teeth. The whole game is staying on the reversible side of that line. So if your gums have been bleeding, take it as the warning it is. Step up your routine or book a cleaning. Drop a comment. Did you think bleeding gums were normal? A lot of people do. Next up, watch my video on why your grandparents lost their teeth. This is a huge part of that story. Hit subscribe and take care of those gums.